Welcome to Live with Hillsdale Hospital. Today is Wednesday, December 17th. So that means there's what, 8 days till Christmas?
Yeah.
Wow. Do you do that at your house, like the 12
The
days?
countdown.
No, you don't. Do you really?
We have an Advent.
Oh, you have the Advent. So you start day one.
Yep.
And then do you put little gifts, little treats,
Mhm.
candies or
Candy.
gifts? Candies.
Yeah.
Awesome. And no one steals the candy before the day of the Advent?
No, she's pretty
Good
good
for
about
you.
it.
Yeah.
Mhm.
We had a young man, I won't say his name was Ryan, at our house who would just go in and eat all the candy.
Yeah.
And then it was like, it was no fun.
Yeah.
But still, it's always great to have those traditions, isn't
Mhm.
it? Christmas
Absolutely.
is coming. And speaking of traditions, we've had you in this room before
Yep.
to have a discussion about case management. And today we're going to talk about something on top of case management that's even equally as exciting for you and your job, which is patient advocacy. But welcome to Live today. I'm your host, JJ Hodshire, President and Chief Executive Officer, and we come to you each week to bring you the latest on what's happening right here in Hillsdale County regarding healthcare. And so today I'm joined in the studio by Nicole Kline. She is our manager of case management or director of that program, as well as recently accepting the position of patient advocate. We're going to talk about what all of that means here in just one moment. But before we do, I'd like to have you share with our listeners today a little bit about your background. When you started Hillsdale, why'd you choose the pathway that you did, and what are you doing now?
Yeah. So when I graduated high school, I had accepted the scholarship. So I went to Siena Heights University and got my bachelor's degree in nursing. Came back to Hillsdale and started my job on the medical surgical floor. I've been there for about a year when I switched to case management.
Yeah.
And I have been there for 9 years.
So reading graduate.
Yep.
And you were a high school student reading,
Mhm.
and you heard about our scholarship.
Yep.
Did someone tell you about it? Did you hear it from a counselor?
Yep. Guidance counselor.
So guidance counselor.
Mhm.
Did you know at that point that you wanted to go into healthcare or no?
Absolutely.
All
Yeah.
right. So
I
you
knew
knew
from a child.
What prompted that?
I don't know. I think I was just always very interested in everyone's care and
Yeah.
making sure that everyone was well cared for, grandparents, parents, even, my sibling.
Yeah.
Yeah.
Were you that person? Are you that person in the family?
I
Try to
don't
be?
I don't know that my husband would say that, but yeah.
Well, take the husband out of it.
Yeah.
All right. How about the parents and the
Yeah,
siblings?
absolutely. Yep.
Right,
Mhm.
right. So you go to, now a lot of individuals go to a 2-year program,
Yep.
which is technically a 3, but at
Mhm.
community college. You chose to go to get your bachelor's degree.
Yep.
So you have a BSN, a bachelor's,
Yep.
right, of science and nursing.
Mhm.
And did you ever go back beyond the bachelor?
I just recently in May got my certification for case management. So
Very
I'm a certified
good.
case manager.
So certified case manager. All right. So
Mhm.
your 1 year work in medical surgical, which is really, the training ground
Yep.
for nurses, and it's a great place to land.
Absolutely.
And then a position must have come open for case management.
Yep.
And what drove you to that?
I really loved the critical thinking that you had to do for that. Not that there isn't critical thinking on med surg, but you really have these problems that come to you and everything's different. There is patient care. Obviously, you see the patients on a daily basis, but the problems are so much different than medication management and things like that.
So obviously you're still caring for, you
Mhm.
round, you have a chance to still impact patient lives. A
Yep.
little different setting.
Very
But
much so.
one of the things that we're hearing right now, and I think your department's involved in it, is the social determinants of health.
Mhm.
And
Yep.
what we're talking about is situations such as housing, food insecurities, medication.
Yep.
And it is now part of the question that your primary care will ask you during your annual. Types of questions they'll ask are, have you been able to pay your rent in the last 12 months? Have you gone hungry at all in the last 12 months? In the last 12 months, has your electricity been shut off? And we're asking these questions with a particular point in mind, and that is to make sure that when they are discharged from the hospital or leave the practice, that those factors don't influence negatively their health.
Absolutely.
Because whether it's depression screening, whether it's we don't have food, so therefore we're not physically strong, whatever those things are. So part of your job is doing that, right?
Mhm.
Talk us through that process. So someone is admitted and you've noticed that there's some social issues going on.
Yeah.
Who do you address those with? How do you address them? How does the patient get help?
Yeah, so multiple assessments are made while a patient's admitted. Our physicians, NP or PAs, as well as the physicians, all do an assessment. And then also our nursing staff will do on the initial interview. So they'll take that assessment. We come in then afterwards, we do our own assessment, but then we also start the referral process. So whatever that might be, whether it's just giving them information, brochures, or what's available and out there, or also trying to get it set up before they leave.
You know, something striking to me has always been the 16 years I've been here, when I've been an administrator on call. Early on in my career, I would come in and pick patients up.
Yeah.
And that was very common. I would do that.
Absolutely.
And I think you even have called me a few times when you're a supervisor to pick patients. And I would deliver patients, right? Because the biggest issue we face, lack of transportation. That's a social issue.
100%.
You know, and we deal with some of those issues. But we've had people who've been discharged from our hospital who have no way home.
Absolutely.
And that's so concerning. You know, they're brought here by the ambulance. There's no family. What do you do in cases where you identify there's a gap? So let's just say the gap is in food. What are you as case management before the patient's discharge doing to address that need?
Yeah. So we're giving them all of the opportunities depending on what their needs are, right? So if it's transportation, getting back and forth, then we're trying to set up transportation to get them to and from their meals, whether it's possibly even having them delivered to the home. And then also giving them the resources. So giving them information on fresh food distribution, the food pantries, meals, whether it be at the senior center, things like that, discounted meals. And then, you know, sometimes it's just picking up. Maybe they aren't able to go in and physically go into the grocery store. So maybe doing pickups instead, whatever that might be.
Yeah. So resources that are available, you're going to share all those, whether it's housing, whether it's food, whether it's their light bill, to try to give them the resources. Now, they have to do some heavy lifting too at times, right?
Yeah.
I mean, you'll help establish a relationship, but they have to do it. Now, one of the other areas that we face right now is what we call social admissions. These are people, individual patients, who may not necessarily have the physical and or the medical requirement to be in the hospital, but family says we can't take care of them anymore. What happens in that situation?
Yeah, so we do have a lot of patients that are like that. They come into the emergency room, whether it's a family issue or whether it's just they don't have the availability to care for themselves at home, then they do unfortunately sit in our emergency room until we find a spot or the resources out there to help them. So we try to find out what their immediate needs are. So maybe they do need help with meals and they need someone to either come into the house or have Meals on Wheels, whether it's home care services, physical therapy, occupational therapy, home health aid, or whether they do need full care and they need to transition to long-term.
So let's talk about the transition, because the number one complaint that I normally get outside of they don't like their bills, and that's a big one, is why aren't you keeping my mom longer? Now, we're regulated by insurance companies and medical necessity. Talk to us about that, because I have a lot of angry people that approach me about, you're letting my mom go too soon. And I have to address that. Or you're letting grandmammy go too soon. So why don't you talk to us about why that is?
So everything has to be medically necessary. So CMS, as well as the insurance companies, hold us to a standard. We have a standard that we literally will go by based off of what their diagnosis is. So we go through on a daily basis to see whether the patient is a responder, a non-responder, a partial responder, and that will let us know if they need to further their care here or if they're able to be discharged. And yes, the insurance companies unfortunately do dictate that. And they'll let us know whether they have a covered or a non-covered day. And that goes for everything, not just for inpatient, but skilled nursing, behavioral health, all of that as well.
So it's all the departments. The other issue that we face is that even after we may have made a recommendation to admit and keep the patient, insurance companies will call some of that money back. We're facing a lot of that. Now, you deal with those denials, right?
Yes.
Talk to us about how all that works.
So initially when a patient comes in, we authorize for their stay. So we send all of the information to the insurance companies. Then they decide whether it's approved or denied. And so sometimes they'll initially approve it and then they'll come back afterwards, and the insurance company will have an audit or something like that, that will come back and say that it wasn't medically necessary, or our coding wasn't correct, or things like that, or they just aren't going to reimburse us what they feel like we deserve. So yeah, that's the utilization review portion of our case management department.
The unfortunate part, though, is that if the insurance company denied it, the patient's still responsible for the bill.
They're responsible for some of their bill.
Yeah.
Yep.
So they could still get a charge on that bill, a portion of it.
Yeah.
Right. Can they fight with the insurance companies, or how does that work?
They most of the time do receive a denial letter as well. And so we will get calls saying, you know, I received a denial letter from my insurance company. They're asking me to appeal. And we just let them know that we are already doing that. Most of the time we appeal all of our denials that we get. There are some times where maybe the insurance company comes back and we don't meet their contractual standards. And unfortunately, there's nothing we can do about those things.
So part of your job, so, you know, obviously utilization and review, discharge planning is planning the patient. That begins about when they start checking in, right?
Absolutely.
I mean, the moment that they check in is when you're starting the discharge planning. What does discharge planning look like, though? I mean, can you give us, I mean, you have a team. I think you want to give a shout out to your team members. You're more than welcome to do that. But then what does that look like?
We're the Smiths. So Maureen Smith, Brianna Smith.
Oh, the Smiths. Sorry.
And so we go in, we assess the patient and their needs. But yeah, absolutely. It starts the moment that they hit the doors, even in the emergency room. Sometimes even prior to that, if a patient's coming in for surgery and we know that they have some needs post-discharge, then we're already working on those things. So yeah, absolutely. We will complete a full assessment to see what everyone's needs are, and then we'll kind of go from there on what referrals need to be sent out or sent home with the patient.
So you heard it here first. You know, obviously the frustration can be at times, I think mom or dad or grandma or grandpa need to be in longer. I just know them. There's something not right, but yet we have to discharge them. The reason we discharge them is because medically there's no reason necessary to keep them, and therefore the insurance will deny it, and therefore the patient gets a balanced bill. It's a big issue and it's a concern, but we have to follow what the insurance companies dictate. Now, the other issue that I want to address is not everybody that leaves the hospital goes home. Some go to residential treatments.
Absolutely.
Some go to skilled nursing. Some go to rehab. But that's all the process as well of being accepted. Because one of the complaints I also get is, you wouldn't take my mom at skilled nursing. Why wouldn't? Talk to us about that process. When do you know that you're going to try to get that person in for some extended care? And when do we know that it's not approved?
So therapy does an evaluation. Based off their evaluation, we will transition or start the transition process. So that does include, if your insurance company does require a prior authorization, which means that we do have to send all the information to them again. That information will then be approved or denied. And we have recently had quite a few denials in which our physician has had to fight for our patients to get into a short-term rehab. But yeah, absolutely. Most of the time, unfortunately, it has to go through them to decide again whether they should stay or they should go.
Yeah. So we're fighting a lot. You know, we're always on the side of the patient and their family.
Absolutely.
And it is a source of frustration for families. But even once they get placed at skilled nursing, that's also a process of evaluation to continue the care there.
Absolutely.
And we've had many families very upset that the insurance says no to it. Now, people can move to private pay, but it's very expensive.
It is, yes. I mean, and most of the time patients are only allowed the first couple days, and then they're up for review again. Once they're up for review, the therapist will again evaluate and send more information. But
so it's quite the process. You have an amazing team. You're doing a great job.
Thank you.
We're very, very thankful for the work that you do to try to find resources for our patients after their discharge, to make sure that they have housing, food. Who would have ever thought that nursing would be social work as well? But it's so rewarding, isn't it?
Oh yeah, absolutely.
And something that you're still helping people like you wanted to be when you were a little girl. Right?
Exactly.
Well, let's talk about another job.
Yeah, absolutely.
Because this one is one that was held by Doris Worley. Doris will, almost 60 years
Yeah.
of work at Hillsdale Hospital. And Maureen Smith has 40.
Yeah.
Yeah, she celebrated 40 years, I believe, last year. But nearly 60 years of work. And so Doris Worley is looking at retirement opportunities.
Yep.
And in preparing for that in the future, we are looking at her position. And she, of course, does 18 jobs. So we're going to have to crop those jobs out to 18 different people. But you're so lucky that you got one of them.
I did.
And one of those jobs is patient advocate. And I would say that in all the years that she's held that, both on and off, it is a very stressful position because in general, when you receive care at a hospital and to get that very high bill, whether it's an ER inpatient, it doesn't set well. And so there's a lot of financial questions. But beyond that, there's also reports of quality of care and concerns regarding the care that individuals receive or the perception of care. Like I went to the ER and I sat there for 3 hours and no one talked with me. And it's our fault because we never went out and talked to them. While in the back, we had 3 heart attacks, 2 car accidents. We just need to communicate and they probably would understand. Regardless, you spend a lot of your time dealing with that. So what is a patient advocate? What are you doing in that position? What advice would you give our patients who come in here who have issues?
So truly, I am here to advocate for the patient. So when someone brings me a concern, I do a thorough investigation and try to obviously look objectively at it and see what else we can find to what was a barrier in their care and then what we can do to try and help prevent this in the future. So once we do our investigation, I always get back with the patient and let them know how we've resolved it on our end. And so, sometimes that is speaking with our patient accounts department or other departments inside the hospital to really get what their thoughts are on what happened and how we can fix it. But anyone who has a concern, obviously feel free to call me. I am available and willing to talk through whatever you feel like the problem or concern was because everything's valid.
And some of our calls come after they're discharged.
Yes.
But you do go into the room now when there's a complaint.
Oh, yeah.
And you'll try to, mitigate that complaint.
Of course.
Conversations about whether it's the food, the heat's, not up. And those are some of the issues you deal with. To after they're discharged, they get the bill. They're also calling you.
Yeah.
And so you have to work with billing on that one. But when it comes to quality of care, you're working with the clinical teams to address them in real time.
Absolutely.
And then find solutions that would be somewhat, appeasing to the resolution for the patient and their family. But we're not always successful in that, right?
No, of course not.
Because perception is an issue.
Yeah, absolutely. Absolutely. Sometimes there is a need for a process improvement, but sometimes, unfortunately, there just isn't. I mean, again, we work in a world where we're lacking staff, we're lacking resources, all of that sort of stuff. So, we're doing the best that we can do. We want to provide the obviously best customer, satisfaction that we can, but sometimes we are limited as well.
Yeah, in an environment where the demand is always there, and it seems like in such a world that we live today, it's always everybody wants everything, they want it now. So when I have to wait an hour for an X-ray read, that can feel like an eternity. When no one's talking to you. And when I'm upstairs laying in the bed and the physician is busy tending to a critical crashing patient, and if you don't communicate that, then the patient thinks that they've been neglected.
Absolutely.
And so it's communication, it's working with the teams. I think we have a great team. I mean, in every department.
Definitely.
Regardless if it's our inpatient psychiatric unit, our OB unit, skilled nursing facility, team and care members who really are interested in improving the health of our patient population. And I think that's your goal.
Oh, yeah.
To make sure that that's done. And then when there is a disconnect, you are available to speak with them.
Absolutely.
So how do they get a hold of a patient advocate? Is there a process?
Nope. You can just call my phone number. So if you call, I will either obviously answer directly or get your message. I try to return all of the calls within 1 business day. And so I'm been pretty successful at that and trying to get back with everyone as soon as possible. But we try to have it resolved pretty much immediately, but within 7 days.
Yeah. So if you're listening today and you thought to yourself, I really want to report that issue. I didn't feel comfortable with this situation, or I didn't get the care level I needed, or I'm really concerned about this area. We'll put in the show notes the phone number, and we are very hopeful that you'd give us the opportunity to fix it first. Oftentimes, how many times does Kirsten send us a Facebook post that we were never alerted of until it was written on Facebook about the care that they received or about a complaint they have? We would encourage you, don't take it to Facebook land right away. First take it to us and give us an opportunity to resolve it, to look into it, because that's exactly what we're going to do. There's not a week that goes by that, someone's not commenting on something and we find out new information via Facebook. Yeah. But if you have a complaint, and it doesn't matter the size of that complaint. If you have a suggestion, we have comment cards that you can put your suggestions and thoughts down. Did you have a good experience, bad experience? You're going to get that card after you're discharged. You're going to have a chance to fill that card out, mail that card back in. And that goes right to me. I review everyone every day. And I will push those cards out if a patient puts on there was this problem or that problem. I actually require follow-up on those. And it may not be me. In many cases, it's not me making a call to the patient. It's our patient advocate. Or it's the manager of the department where the situation of the concern was. So please let your voice be heard. If you're an individual who has concerns about the care of any nature here at Hillsdale, please reach out to us. We want to hear from you. We want to resolve those issues so we don't have those type of mistakes into the future. Yeah. And so great job to you and your team. You're doing a phenomenal job. I'm very proud of the work that you've done, staying on top of some of these very critical issues. But, at the end of the day, giving great patient care, which is what our team does. And you support them in that every day. So thank you, Nicole. We appreciate all you do.
Thank you.
Hails from Reading, Michigan, home of the Rangers. Yes. And graduate of Siena, and certainly has taken the lead here as one of our rising stars as a manager. So we appreciate all that Nicole does. And we want to thank you, our listener, for listening to these types of programs, as well as our podcasts, lives, as well as walking through the doors of the hospital and our clinics to support these services. We exist for one purpose and one purpose only, to take care of you, our patients. Without that, there is no need to exist. And so we entrust you to use our services. In return, we'll make sure that we entrust our care team to provide the highest level of care possible at the lowest cost point possible for you and your family. And so if you have a concern, if you have an issue, please bring those forward. Nicole or myself, we'd love to hear from you. If you have ideas, suggestions, we'd love to hear from you as well. If you want to recognize a care provider for the care that you received while you were in the hospice or while you were at the clinic, or whether you were visiting one of our outpatient centers, by all means, drop us a line, a quick post on our Facebook feed, and or sending me a note. We'd like to praise our staff. They love to hear positivity because we are surrounded in a world of negativity. And we always accentuate, the challenges and the concerns, but oftentimes what is drowned out is the praise and the great work that our team does. So we want to stop here and pause to thank them for the hard work that team, our clinical teams, do each and every day. If you're looking to join an award-winning team, there's an opportunity there as well. Go to hillsdalehospital.com. Under the career tab, you can see all the open positions. Also on that webpage is a place for you to donate. If you're making end of the year decisions about where to donate, we're a tax exempt, which allows us as a non-for-profit to issue you a tax deduction letter for any amount that you give. So as you make those considerations this year, before we close out our calendar year, and you want to make a charitable donation, you can designate that to any department. You can't designate to a person, but you can designate it to a department, a program, a process, whatever it is that you want to do. But give us some consideration as a place to be able to make donations. If you have estates, wills, giving, future state, we'd love to hear from you. Kirsten Newlon is helping us with that project. And there's a spot on our website where you can donate or reach out to us if you want to have those type of discussions. If you're looking to join an award-winning team, look no further. We have job openings. Our staff love it here, Nicole. And you've been here since 2015. Yeah. I've been here since 2010. I wouldn't want to work anywhere else. It is an incredible place to work. Our staff are friendly. It's just home. It's just a great place. But we have job openings right now. So if you want to join an award-winning team in the nation and in the state, which will release some other awards that we received here very soon, look no further. You can find an opportunity, and that opportunity can lead to other opportunities, whether it's in education, continuing education, whether it's in management, opportunities to go volunteer, whatever it is, they exist right here. Go to our website. under the career tab. We'd love to hear from you if you're interested in applying. And then always to stay up to date, these types of programs are critically important for our community. And we like to do this as often as we can as lives, but every week we can guarantee a radio program on 102.5 and 92.1. Both radio stations will facilitate our weekly radio address, which is usually who we have in the studio. We try to have as a radio guest to share the similar information to a different audience. And so tune in to those two places, as well as tuning in to our podcast, Rural Health Today. So subscribe wherever you get your podcast to Rural Health Today, where we talk about the issues facing the enterprise of healthcare in the rural America. And it is of grave nature and concern today that 150 or more now hospitals have closed in this country. We're trying to raise the awareness through this podcast that rural health sustainability is the only answer to ensuring the economic viability of our respective communities, as well as a feeder for future generations of healthcare workers, your local hospital. So thank you for entrusting us with your care. If you have concerns or issues, bring them forward. And we look forward to seeing you here again, hopefully next week, but certainly on our podcast, Rural Health Today, on either of our mediums for communication, which is listening to a live event or listening to us on any other channels that we post. We'd love just to hear from you if you have any thoughts, comments about how we can improve the services that we render. And until next time, stay rural health strong.